Hello, everyone. My name is LaShawn Favors, and I am what you would call a doctor nurse. I tell people that I have the best of both worlds, where I could diagnose, treat, and care all at the same time. So I'm a doc. I have my doctorate degree. I'm a family nurse practitioner. I went up the ladder with degree-wise with my associates in science in nursing, bachelor's in science in nursing, public health nurse, registered nurse. Um, Master's in science in nursing, and my terminal degree, which is my doctorate. They gave me the doctor in front of my name academically. I am here to let you guys know a little bit of something that was a bit surprising, but not surprising to me. Did you guys know that the third leading cause of death in America is medical errors? The Washington Post researchers concluded that medical errors now is the third leading cause of death in the United States. The NPR also stated that medical errors are the number three, which is the third cause of U.S. deaths, according to researchers. Now, in understanding this, we need to understand that how did we get here? How did we get here? Well, let me walk you through something. Let me walk you through a typical shift, okay? A typical shift that a registered nurse has to go through on every time she goes to work. It's gotten to the point where nurses are not crying for money. They do not take the overtime or the benefit of, oh, if you stay over, we'll give you double, we'll give you triple. They don't even do that. They don't even take that offer because it's really sad to see that our patients are not getting what they need, and by us standing up for them, we're not getting what we need to be able to stand up for them. And being altruistic, when you care for your patients, it's not an easy task, and it's definitely not an easy feat. So let me just walk you through a typical shift assignment, okay, to the medical surgical telemetry floor. All right. So you get assigned your patient, and let's say you have been assigned a patient in room 1 that is an 89-year-old male who has Alzheimer's dementia and sundowners. You're assigned to room 2 that is a 32-year-old female, mother of 3 small children, who has advanced breast cancer. Room 3, you're assigned to room 3, which is a 58-year-old male who is a GI, gastrointestinal patient, who is having a EGD, which is an esophageal gastroduodenoscopy, plus a colonoscopy procedure in the morning. And you're assigned room 4, which is a pre-op surgical patient, prepping for surgical prep for in the morning. And a room 5, you're assigned room 5, which is a 49-year-old male who has cirrhosis of the liver, and you have to watch out because he is alcoholic, and we got to watch out for some ETOH withdrawals, okay, like delirium tremens. All right, so let's say room 1 was ordered a bedside sitter. Now, this is, I'm not going to say let's say, because this is actually something that I was assigned before. Let's go. So room 1 was ordered a bedside sitter, but the hospital said that they didn't have the staff for a sitter, so they just put him closer to the nursing station. The patient is pulling out his IV, climbing out of bed, and has fallen to the floor. He busted his head. I called the physician, of course. Physician orders a brain scan, x-ray, and soft wrist restraints that I must check every hour to remove, adjust, make sure everything is fine every hour. And then my patient in room 2, my cancer patient, she's emaciated. I see that. She's sad and she really wants to talk to me, but I just don't have the time to do it. But I want to, and I'm going to make the time, right? She looks like she is tired and wanted to give up. Her family is at the bedside and would like to ask me some questions. And I look at her chart and I notice that she has a medication prescribed to her that works on for pharmacokinetics. It inhibits the ovary from producing estrogen. The patient's history states that she had a Ufer-Salpingo hysterectomy, which means that she has no ovaries, she has no fallopian tubes, she has no uterus, okay? So that means that, but yet the medication that is ordered has terrible side effects, which can cause exacerbations of depression, which she has, nausea, vomiting, stomach pain, and not wanting to eat. She's emaciated. So my little, wheels are turning like, oh my goodness, let me call the doctor. So I called the physician to let him know that the medication must be prescribed in error because the medication can't work without the ovaries, so that it affects. So it appears to be attributing to her symptoms. So guess what the physician's response is? You woke me up. Don't question my orders. I'm your superior, and I'm calling your supervisor to get you fired. Wow. Okay.